Welcome to this educational video on the Treadmill Stress Test by Cardiovascular Technology students of Politeknik Brunei. This video is designed to help patients and healthcare students understand how the test works, what to expect, and how to prepare for it. The Treadmill Stress Test evaluates how your heart responds to exercise. It helps doctors identify coronary artery disease, assess exercise tolerance, and monitor cardiac function during stress. You'll learn about the indications, contraindications, patient preparation, and post-procedure expectations of this important diagnostic test. Indications. A treadmill stress test is recommended for several reasons. First, to evaluate chest pain or discomfort that may suggest coronary artery disease. Second, to assess exercise-induced arrhythmias or palpitations. Third, to determine a person's exercise capacity, useful for athletes or patients recovering from heart conditions. Finally, to monitor the effectiveness of cardiac rehabilitation or medications that affect the heart. Contraindications. Although the treadmill stress test is generally safe, there are times when it should not be performed. Absolute contraindications include a recent heart attack within 2 days, unstable angina, severe aortic stenosis, uncontrolled arrhythmias, or acute heart failure. Relative contraindications include severe hypertension, electrolyte imbalances, uncontrolled diabetes, or any physical limitation that makes walking unsafe. The test is always performed under supervision by trained professionals for patient safety. Patient preparation. Before the test, patient preparation is essential to ensure accurate results and safety. The healthcare team will explain the purpose and process of the test and obtain informed consent. You will be asked to avoid heavy meals, caffeine, and smoking for at least 3 hours before the test. Wear comfortable clothing and shoes suitable for walking. Continue or stop certain medications as advised by your doctor. On the day of the test, your vital signs will be checked and your medical history reviewed. The technologist will prepare your skin by cleaning and lightly abrading it to ensure good contact for ECG electrodes. 10 electrodes are then placed on the chest and limbs for ECG monitoring. A blood pressure cuff will be attached to your arm, and baseline ECG and blood pressure readings are taken before you start. During the procedure, once you're ready, the treadmill will start at a slow pace. The test usually follows the Bruce protocol, where the speed and incline increase every 3 minutes. Throughout the test, your heart rhythm, blood pressure, and symptoms are continuously monitored. You'll be encouraged to continue walking for as long as you can. The technologist will ask how you feel at each stage, checking for shortness of breath, fatigue, or chest discomfort. The goal is to reach your target heart rate, which is about 85% of your maximum heart rate, calculated as 220 minus your age. The test will be stopped immediately if you experience severe symptoms, significant ECG changes, or if the technologist or doctor determines it's unsafe to continue. After the procedure. After the test, the treadmill slows down gradually for a cool-down period. You'll continue to be monitored while your heart rate and blood pressure return to normal. Once your readings stabilize, you'll be allowed to rest. The physician will then analyze the ECG recordings and report findings such as presence of ST segment changes, heart rate recovery, and any symptoms experienced during the test. Results will be discussed with you afterward to guide diagnosis or treatment. In summary, the treadmill stress test is a safe, non-invasive, and reliable method for evaluating how your heart performs under stress. Understanding the indications, contraindications, preparation, and aftercare helps patients feel more confident and improves healthcare safety. For healthcare trainees, Mastering the correct procedure ensures accuracy and patient comfort. Thank you for watching this video, brought to you by students of the Cardiovascular Technology program at Politeknik Brunei.